Okay, let's talk about something a lot of us go through, especially when we're younger, but maybe don't totally get missed periods. Now, it can be pretty common for your cycle to be a little unpredictable at first, but if you're consistently skipping them, that could be your body trying to send you a really important signal. So let's just get right to it. Have you ever had a month go by, maybe another one, with no period, and you're kind of wondering, is this okay or should I be worried? It's a completely valid question, and today we're going to unpack what your body is actually trying to tell you. All right, first things first. Before we can figure out why a period might go missing, we have to know how a typical cycle is supposed to work in the first place. Nailing down this baseline is the key to spotting when things are off. So a typical cycle is like this rhythmic dance of hormones. It kicks off with a follicular phase where an egg gets ready. Then you've got ovulation. That's the main event when the egg is released. After that is the luteal phase, which preps the uterus. And finally, if a pregnancy doesn't happen, the whole thing wraps up with your period. So who's running this whole show? Well, it's mostly two key hormones. In the first half of your cycle, estrogen is the builder. Its job is to thicken the lining of your uterus, which is called the endometrium. Then, after you ovulate, progesterone swoops in. Think of it as the stabilizer, getting that lining all ready and holding it in place. And here's the most important part, the drop in progesterone. That's the chemical signal that tells your uterus, okay, it's time to shed the lining, and boom, your period starts. Okay, so what happens when that rhythm gets all messed up? It's totally normal for cycles to be a bit wacky for the first year or two after you start getting them. But when they consistently go off the rails, it's a sign that something in that whole hormonal system is out of whack. And what does off track even look like? Well, instead of that predictable 21 to 34-day pattern, your cycle might suddenly get super short, maybe 12 days, or stretch out to 45 days or even longer. But it's not just about the timing. It's a clue that those internal hormonal signals aren't firing the way they should be. And that leads us to the big question. What if that critical signal, that drop in progesterone that screams, it's time to shed, is just missing? What actually happens inside your body when the message to start your period just never shows up? This is where things get really important. Because while skipping a period might seem kind of convenient, ignoring it for a long time can carry a pretty significant and often hidden risk for your health. This is something we all need to know about. That risk actually has a name, endometrial hyperplasia. Let's break that down real quick. Endometrial refers to the endometrium, that uterine lining we've been talking about. And hyperplasia, it's just a fancy word for overgrowth. So it's a condition where the lining of the uterus gets abnormally thick. And this is exactly why it happens. Every month that you don't get a period, that builder hormone, estrogen, just keeps on adding layers to the uterine wall. Without that signal to shed, the lining just keeps building up on itself, month after month. So how does this actually lead to a more serious risk? Well, it's a pretty clear chain of events. 1. The signal to have a period is missing. 2. The uterine lining doesn't get the message to leave. 3. It just keeps getting thicker and thicker, leading to that hyperplasia. And 4. This is the crucial step. That super thick lining creates an environment where irregular cells are more likely to pop up, and over time, those cells can turn into cancer. And the science is really clear here. Our source material puts it plainly. Too much endometrium means a higher chance of irregular cells. With time, these irregular cells can turn into uterine cancer. Now, this isn't meant to scare you, but to empower you. Knowledge is power, right? So now that we get the risk, let's talk about the most important part, the plan. What can you actually do about this? And the good news is you have a ton of options and you're in the driver's seat. Here's the number one thing to remember. If you notice your period is consistently a month or more late, the first step is not to panic. Things like stress or big changes in your diet can throw things off sometimes. But if it becomes a regular pattern, that's your cue. It's time to go chat with a doctor. And remember, seeing a doctor isn't about something being wrong with you. It's about being proactive and smart about your health. Think of them as a partner who's there to help you figure out your body's unique rhythm and get to the bottom of what's going on. And honestly, the appointment itself is usually really straightforward. It'll probably start with just a conversation, about your health history and your cycles. They might do a simple blood test to check your hormone levels, and maybe an ultrasound, which is totally painless and just gives them a picture of your uterus to see how thick the lining is. It's all just about getting the info they need. And finally, let's talk about solutions, because the best news is that once you know what's up, there are a lot of really effective ways to manage your cycle, protect your uterus, and get everything back on track. So, depending on what's going on with you specifically, your doctor might talk about a few different options. Maybe oral contraceptives to help stabilize your hormones, or taking progesterone for a little while to kickstart your period. For some people, hormonal IUDs are a great option to manage the lining directly. If something else is causing the issue, there are other meds that can help. The whole goal is just to find the perfect fit for your body. At the end of the day, your menstrual cycle is so much more than just a period. It's a vital sign, basically a monthly report card on your hormonal health. So the real question is, are you listening to what your body is trying to tell you? Because understanding your cycle is one of the most powerful things you can do for your health in the long run. Thanks for tuning in.